Distinguished guests, ladies and gentlemen, I'm very happy to be here this morning for the opening of Sengkang General Hospital and Sengkang Community Hospital. This is my second visit to Sengkang hospitals. I came informally last December just for jalan-jalan, to take a look around the new facilities and to meet the staff who are starting up these new hospitals. I was happy to find them in good spirits, gearing up progressively, getting used to their new surroundings. I met some patients too. Most of them were residents living nearby, and they were glad that a hospital had opened in their neighborhood and they no longer had to travel all the way to Tan Tock Seng Hospital or to Khoo Teck Puat Hospital to get treatment. But there were also a few visitors not from Sengkang or Punggol, but curious Singaporeans who had come from other towns like Yishun or Pasir Ris and were also welcome here. Indeed, all of us have been eagerly awaiting Sengkang Hospital's opening since we started planning it 8 years ago. This hospital is part of our Healthcare 2020 Master Plan to steadily build and expand medical facilities across the island and to bring healthcare closer to our homes. In 2010, Khoo Teck Puat Hospital opened in the north, and about 4 years ago, Ng Teng Fong General Hospital and Jurong Community Hospital opened in the west. Today, we formally open Sengkang hospitals, the SKH and SKCH, and these will serve residents in the northeast, especially in Sengkang and Punggol. And next year, Outram Community Hospital will open. And then around 2022, Woodlands General Hospital, as well as Tan Tock Seng's Integrated Care Hub, will also open. We are building these new facilities because we need additional capacity. Our total patient numbers have been rising steadily, and there are a few reasons for this. Firstly, Singaporeans are living longer. Average life expectancy of a baby born today is about 85 years. And one recent study puts that as number one in the world. But even if you're not number one, you're number two, number three. And I'm quite sure in the next 85 years, with new medical advances, that baby born today can expect to live 87, 88, maybe even 90 years. It's completely possible. In fact, even today, 1 in 7 of the babies can expect to live to at least 95. So that's good news, but unfortunately, the additional years of life are not always additional years of health. Because on average, although the life expectancy is 85 years, the healthy life expectancy is only about 75 years, which means we can expect to experience about 10 years of ill health in our lives, and mostly it will be when we have grown old. So we need more additional beds to take care of the growing numbers of elderly who need medical care. That's the first reason, because people are living longer. The second reason is we're also having more chronic diseases, diabetes, hypertension, high cholesterol. The prevalence has increased. If you go back and compare from 2010 to 2017, it's gone up 4% for diabetes, 14% for hypertension, 33% for high cholesterol. It's partly because our population is older, and older people are more prone to these conditions. But it's also because of unhealthy lifestyles and habits, not eating properly, not exercising enough, becoming more sedentary, more overweight. Worse, if these conditions are not managed well, more serious complications will set in, and quite likely the patients will see more hospitalization. The third reason is that we not only have more seniors, but also smaller families, and therefore a larger proportion of seniors in the population. So there are fewer family members to look after each aged sick person at home. And with less family and social support, chronic medical conditions are likely to worsen, which will result in more admissions to hospitals. So our healthcare system must adapt to all these changes in our population and in our healthcare needs. And it's not just building more capacity, but also using this capacity more efficiently and effectively. One major shift we are making is towards a more patient-centric, multidisciplinary approach. And for hospitals, that means putting together more services in one location, which is why we've co-located Sengkang General Hospital and the Sengkang Community Hospitals, just as we've done with Ng Teng Fong General Hospital and Jurong Community Hospital, because this allows the general and the community hospitals to operate as one single integrated entity, especially in the services which they provide. Patients at Sengkang hospitals can receive a wide range of medical services, from initial diagnosis and treatment to recuperation. For example, a patient who's been treated at Sengkang General Hospital can be smoothly transferred, I think, from this side to that side to the community hospital for rehabilitation and continuing care. And this is especially helpful for older residents who need longer to recover. The doctors and staff in both hospitals can work together as a team, look after the patient comprehensively and holistically, and administration is also simplified. So the National Cancer Center, the National Dental Center, the National Heart Center, the SNEC, the Eye Center, NNI, the Neuroscience Institute, and KK Women's and Children's Hospitals, they all operate satellite clinics here at Sengkang General Hospitals, at the Sengkang Medical Center, so that patients who need more specialized services can readily access the clinics here. They don't have to go all the way to all these different centers all over Singapore. Of course, improving hospitals is just one aspect of improving our overall healthcare system. Primary care plays a crucial role. For example, a network of GPs and polyclinics. Sengkang Hospital and SKCH, as a new and modern hospital campus, can drive improvements in this network. For example, SKH is partnering almost 30 GPs in Sengkang and Punggol to provide general chronic disease management, and is also supporting the Punggol and Sengkang polyclinics to manage more complex diabetes cases. These two hospitals also lead the integration of social and healthcare services in the community. Sengkang Hospital organizes regular health screening together with GP and community partners, and after screening, the patients can immediately follow up at the Chiez GP clinics, which is very important because if they don't follow up, not only is the screening wasted effort, but worse, if the condition gets worse later, it will become much harder and more expensive to treat. SKCH also partners the National Heritage Board to conduct reminiscence therapy for elderly patients with dementia, brings them to historic places like the Sun Yat-sen Memorial, and making traditional goodies like huat kueh. Of course, the best thing we can do for ourselves is to take care of our own health, stay healthy, and avoid going to hospital at all. Because if you have an accident and injury and need to go to hospital, well, that can't be helped. But many diseases are preventable if we watch our diet and lead healthy lifestyles. SKH runs community programs to encourage residents, young and old, to stay healthy, eat well, and exercise regularly. You saw some of the activities they organized this morning, and we participated in them too. I think if we do that every day, we will feel better every morning. Sengkang Hospital staff give talks on childhood obesity and diabetes prevention to primary schools. They teach parents and teachers how their children can practice healthy living from young. And the programs have been effective because while we're not always careful with our own health, we love our children and we're much more concerned about theirs. So improving our healthcare system is a collective effort. The government is building more and better facilities staffed with well-trained doctors and nurses. We are structuring the system correctly so that people get the right type of treatment at the right place and the right cost. The healthcare community needs to work together to deliver this. And at the same time, each one of us must take responsibility for our own health. Singapore spends less on healthcare than most other developed countries, and yet we have better outcomes. We have needed to spend less, partly because our population was younger and has only recently begun aging. But the main reason is because we have structured our system properly and built in the right incentives to guard against overconsumption of healthcare services. This is not easy to do because it's very difficult to tell people that the treatment they want is not really necessary or not cost-effective. And yet, we have to watch carefully how heavily the government subsidizes healthcare. Not just to save taxpayers money, but to avoid encouraging overtreatment by doctors and overconsumption of healthcare services. In countries with very high subsidies or free healthcare, free at point of use, people worry less about the healthcare costs, and doctors correspondingly prescribe more unnecessary and expensive tests and treatments. Already, our government's health expenditure exceeds $9 billion a year, and it's rising faster than our GDP, and it's certain to rise further. Eventually, we can't sustain this. So in the medium term, we have to find new ways to fund this healthcare spending. But at the same time, we have to think hard about what we must spend on and which drugs and procedures are cost-effective. And we have to make hard choices, and I hope we will have the support of Singaporeans when we make them. This healthcare system is one of the best in the world. And for this, we owe much to the thousands of healthcare workers who work day and night to keep it going, to make sure it delivers good healthcare and takes good care of the patients. The doctors, the nurses, the allied health professionals, the medical social workers, the hospital and polyclinic administrators, the IT support staff, and many others. You give your best every day, working hard, often under difficult and stressful conditions. You make all the difference when we are hospitalized or when we are unwell and we need help. So on behalf of all Singaporeans, I would like to thank you for being patient, committed, and competent, and for taking good care of Singaporeans who need medical help, which is all of us at some time or other. So once again, let me congratulate Sengkang General and Community Hospitals on your opening. I'm confident that you will care for many patients professionally, competently, and compassionately for many years to come. Thank you very much.